If you're watching this video, unfortunately you and many others are suffering from poor quality sleep and you're looking for answers. I'm here first to reassure you, you're not the only one suffering from poor sleep. Victims of insomnia go back millennia, and one of the greatest poets of all time has even captured the true pain and suffering from insomnia in one of the greatest plays ever written. Methought I heard a voice cry, "Sleep no more! Macbeth does murder sleep! The innocent sleep, sleep that knits up the raveled sleeve of care. Sore labor's bath, balm of hurt minds, great nature's second course, chief nourisher in life's feast." So if you're feeling frustrated by insomnia, you're not alone. In this video, we'll talk about why we sleep, how much sleep we need, how to improve your sleep, and when to see your doctor. Once again, this is not medical advice. If you are my patient and you have any specific concerns, please talk with me. And for everyone else, please talk with your own family physician about how to help with your sleep. First of all, why do we need sleep? Well, sleep is super important for brain health, mental health, heart health, proper metabolism, healthy immune function, reducing obesity. The list goes on. Chronic lack of good quality sleep will not only make you feel bad, they also increase the risk of high blood pressure, cardiovascular disease, mental health disorders, and it even reduces your body's immune response to vaccines. So yes, it'll be best to get a good night's sleep before and after your COVID vaccine in order for the best immune protection against the virus. In fact, sleep deprivation is so harmful that they've even removed it from the Guinness Book of World Records. Nobody is allowed to sleep deprive themselves anymore in order to break the world record. We all need sleep, and we need good quality sleep. In fact, sleep is so important to us that there's phrases and expressions out there with the word sleep in it that we say on a routine basis without even knowing. For instance, when we need to get over something bad, we say, "Sleep it off." And when we can't solve a difficult problem, we say, "It's okay, I'll sleep on it." And when we need to look especially good one day, we say, "It's time to get our beauty sleep." So how much sleep do we need? Well, it varies depending on age. But the average adult requires 8 hours of good quality sleep per night. Some people think they can catch up on sleep on nights when they're less busy. Sorry, but the data shows that once you've lost your sleep, you've lost it. Many people brag that they can get less than 8 hours of sleep and still function normally. This is not proven to be true in the data. Apparently, there is a genetic mutation that allows some people to function normally at less than 8 hours of sleep at night. But unfortunately, having this mutation is rarer than getting struck by lightning. Also scary is the fact that we could be sleep deprived without even knowing it. In one study, researchers took two groups of people. The first group are people who pulled all-nighters. The second group are people who slept only 6 hours of sleep every day for 1 week. They asked both groups to do the same types of cognitive tasks, and they found that both groups performed about the same. If you've been getting 6 hours of sleep consistently the last while, you're functioning at the level of somebody who just pulled an all-nighter. But then the researchers asked each group to rank how sleep deprived they were. The group that didn't sleep at all for 24 hours ranked themselves appropriately as sleep deprived. The group that received 6 hours of sleep per night for the last week did not score themselves as sleep deprived. That's quite scary. People can be sleep deprived without even knowing it. Many people try to get the sleep they need through medication, and we as a culture have become accustomed to reaching for that over-the-counter pill. And while melatonin isn't necessarily bad, prescription sleep medications can be bad for you. The reasons for this are complicated, but to simplify this for my patients, the medication changes the brainwave pattern during your sleep, so that even when you feel rested when you wake up, it is less healthy of a sleep than if you went to sleep normally, with no medication to assist you. We as humans were born with the tools for sleep, so why rely on a drug? To help you with your sleep, here are my top 5 tips that I give to all my patients. Number 5. Make sure your bedroom is dark and quiet. And if you can't make it dark and quiet, make sure to sleep with earplugs and eye shades. And it might be something that you just have to get used to. One common way that patients can do to improve the environment in which they sleep is to take the TV out of the bedroom. And similarly, remove any distractions in the bedroom that can create light or noise. Number 4, don't nap during the day. Instead, do the opposite. Be physically active.
Cycling the Legacy Trail right now. Just check in to make sure, oh, that guy just got along without a bell. Unprofessional conduct right there.
The only caveat to this is not to do intense physical activity near bedtime. We don't want to overstimulate the body while it's winding down and preparing you for sleep. Number 3, don't eat anything or drink anything other than water within 3 hours before bed. Eating or drinking something other than water so close to bedtime will increase your blood sugar levels and will prevent you from falling asleep. You don't want to be drinking coffee in the afternoon. Avoid that after dinner tea or coffee. Some people drink alcohol before bed to help them sleep. But once the alcohol wears off, it could make you more anxious and reduce your ability to fall asleep over the long term. Some people take medical marijuana to fall asleep. While it may work in some, it doesn't work in others, and its effects on your body are unpredictable. So again, I go back to what I said. You were born with the tools for sleep. Why would you rely on something else? Number 2, keep the bed only for sleep. A lot of people like to do things on the bed, like homework or watching movies. But subconsciously, just like Pavlov's dog was trained to salivate at the sound of a bell, these folks who do stuff on their bed are subconsciously training themselves to associate the bed with a place to be awake on, instead of a place to fall asleep on. So keep the bed only for your sleep. Related to that is, if you can't fall asleep after 10 or 15 minutes of trying, don't try anymore. Get up out of bed, go to a dark, quiet room with low light, no screens, do some light reading or some relaxing things, and then once you feel tired again, you can try to go back to bed. Train your brain to relate bed with sleep and nothing else. And number 1, be consistent. What I mean by that is wake up at the same time every day and go to bed at the same time every day, regardless of whether it's a weekend or a weekday. That is the most important tip I can give you. Society doesn't set us up for success when it comes to sleep. 24-hour entertainment, street lights, morning classes for teenagers, and weekends. God, the weekends. Now it's okay. If you like to sleep in, then sleep in every day. If you like to wake up early, then wake up early every day. The science has shown that there are definitely 2 types of people, the morning people and the night owls. But whatever your sleep pattern and your sleep habits, as long as you wake up and go to bed at the same time every day and have that nice routine, you'll be set up for success when it comes to sleep. Now that was a summary of my top 5 tips that I tell my patients for how to get a better night's sleep. If you have put them into practice, it's important to turn them into habits, not just something you do on a week or 2-week basis. But if they're still not working for you, then let your doctor know. There are many medical and psychiatric conditions that affect sleep, and these include sleep apnea, anxiety, and things like that. And when those are affecting sleep, it's important to treat those first, so please see your doctor. Now, even though I was so harsh on sleeping pills earlier in the video, I do acknowledge that they can be helpful for some people in the short term. Again, see your doctor about that. And what will be extra helpful is if you keep a sleep diary or a sleep journal that records how well you slept on each day and associates your sleep with different factors like what happened on the day, what you ate, how much you exercised, and other possible contributing factors that may affect your sleep. So that's it for now. I hope you've gotten something useful and actionable from this video. And once again, if you're having sleep issues, your family doctor will always be there for you. Take care and stay healthy.